Welcome to The Dental Brief, the podcast that delivers actionable insights and expert strategies to help dental professionals like you grow, lead, and succeed. I'm your host, Patrick Shavasty, the president of Omni Premier Marketing. Every week at The Dental Brief, we bring you real conversations from expert speakers that offer expert advice and quick tips that make a real difference in practices nationwide. Whether you're a general dentist or run a multi-location practice, we've got you covered with content that's designed to help you attract more patients, to streamline your operations, reduce headaches in managing your practice, and increase your profitability. If you're ready to elevate your practice, be sure to subscribe, hit the notifications bell, and let's dive into today's episode of The Dental Brief. Hello, everyone. Welcome to another episode of The Dental Brief. Excited for today's program. I always love it when dentists come on the program to share. Let's get right into it. Dr. Lowe, say hello to everyone.
Hello, how you doing? Thanks for having me.
Yep, glad to have you here again. Thank you for taking the time to share with our audience. Let's start where we always start. Tell me, how did you become a doctor?
Well, it's kind of took a long way to get there, but something I think I thought about when I was in high school, elementary school, because I had braces. So going to see the orthodontist, I liked him, and I liked my general practitioner. Thought he's a cool guy. So I liked about it, thought about it, but I'd never pursued it. I initially got my degree from Michigan State in turf grass science and soil sciences to be working the golf course industry. So I did that, graduated, started working at that. And then I decided I don't really want to do this the rest of my life. So then I went back to dental school, applied, had to do some prereqs again. And so long road, 10 years later, I did it.
I was hoping you were going to say you got into golf course management, met a bunch of dentists, and decided to become one. But no, kind of short.
Well, there is some of that, because I know when I was working on the golf courses, I would always watch what they were doing, and I liked it a lot more than what I was doing. So I was like, how do I do that?
Yeah, makes sense to me. All right, so you practiced as a general dentist for quite some time, correct?
Yes, I graduated in 2009.
And then you went on to kind of, I want to say invent a product. Tell me if that's a little off. You ended up inventing a product, Tefball, is that correct?
True. Yeah. So I was practicing, well, now it's been 15, 16 years. And it was one of those things that early on, I kind of thought it was very odd when I was restoring an implant that of anything else in dentistry, it's quite regulated. It's a specific product. You got it from a reputable source. You had it. It was to certain standards. But there I was restoring implants and just throwing in pieces of cotton or plumber's tape. And it didn't really seem, from an ethical standpoint, for me right. I didn't feel good about it because it wasn't clean, sanitary, or anything. So that was a kind of something I thought, I got to do something better. So after thinking about it, it just kind of popped in my head one day what I wanted the design for this to be and what did I want it to be. So that's where I came up with Tefball. And it's just like a round little device that you would put into when you're restoring implants into the abutment. You put something with screw access holes, and then you put your film material over top of that. So it was, and I wanted something that was clean. I wanted something that resisted absorbing moisture. And then through time, because anyone who's ever restored an implant, you take that off. When you get in there, if you were taking cotton in there or something else, there's a smell. There's like a foul odor. It stinks. So I was like, this is clearly not good, because every single time a patient was like, what is that smell? And
right.
And if there's that, there's bacteria, because there's always micro leakage. So it's just not right. So then I developed this product, and it's a medical grade silicone, basically like a plastic kind of thing that you would place in there. That's up to the FDA standards of materials, and it works good. It took me years of trying out little iterations of it to come up with the right material, the right size. How do you make it and be able to make enough of it so that it doesn't cost an arm and a leg, which has been the hardest thing to do, I would say, is trying to make a modern solution with historic old pricing. It doesn't work because technology costs more, right?
Sure.
And so then I found out, so that was a really hard thing to do, was to find someone who could manufacture it, because it's tiny. very tiny. And if you've seen an abutment access there for the crown or the abutment, it's tiny, right? So
Sure.
getting that made at a volume that's affordable was really hard because only a few micromolding people in the States and I want it made in America. That was another thing too. I wanted to make sure it was part of the thing. I want to make sure it's done right.
Yep.
So then learning how to manufacture, finding a manufacturer. Now we're about, 4 or 5 years down the road. And then it's a whole nother thing of talking to FDA regulators to get the product, like the self-regulated F1 device. And there's a plethora of things and you have to go through of getting a corporation set up for it. How do you get it to people? How do people see it? Which I found now is like what I thought was going to be the really hard part, which has been really hard for years to get people to think of it, come up with the material, make it at a level that you can distribute it, packaging it, labeling it, branding it. Now to get it out to the dentists has been really hard. I didn't realize how hard marketing and like the product development is one thing, but getting it into people's hands and getting them to know about it is hard. It's really hard.
So those that, and I'm glad you're here talking about it, because those that are using it seem to really love this product, right?
Yeah. The people that have used it are happy with what it is and what it does, and then the outcome of it. Yeah.
Yep. So what about saving time? I know a lot of my listeners are coming here because they're trying to find ways to grow their practice, build their practice, be more efficient, more effective. How does this help a practice in that area?
Yeah, good question. Because that was something I didn't really think of initially. I was just so zoned in on making like something that was clean and sterile and really good product. But the side thing is, it saves time. So you're going to save chair time because anyone who's ever had to place it and then also remove the material they've been using, it costs time. So there's a time savings, 100% placing it, chair time saved in removing it. That's pays for itself in time, right? You extrapolate that over, your month, your week, your year, your career, whatever. And also the staff I found is happy about doing something better too.
Yeah, right. Better for the patient, better for everyone.
Yeah.
Yep. So tell me the name. I know your website. I want to invite our listeners to check it out. Price is really reasonable. I mean, it seems like the price makes total sense to at least give it a try one time. Tell me how you came up with the name. Your website's Tefball, TEFBALL.com. How'd that name come about?
Tefball came up because two things. One was a typical product people use was like Teflon tape. So it was like a play on the words. And then it's shaped like a ball. So Tefball. So it's pretty, I thought.
That easy.
It would be something people would remember and then they could relate to. And then Tefball.com obviously is a website. So that was how I came up with the name.
Do you think a dentist has to be doing a certain amount of implant restorations per month for this to make sense? Do you think they're just, how has the shelf life of the product? Is there any concerns there?
I don't think there's any problems with, you don't have to do large volume at all because it could be you could be one a month or one every few months because the shelf life, it's not going to go bad. Right. It's packaged in a clean environment. So again, something that is different from any product they're using now. So no concerns at all. Perfect.
All right. So Tefball.com is the website. Price is really simple. It's right on there. I'll leave it a mystery, but it's, price is very, very reasonable. So I would even say it's low cost in the grand scheme of things. I want to encourage our audience to go check it out. Dr. Lowe, anything else that you want to share with our listeners before you go?
Well, why don't we make a little discount code then for anybody who's listening to this?
Code Dental Brief for a nice discount. Shipping time, about how long from the time the order is placed till they receive it?
It's pretty quick. It could be a couple of days to a week.
Awesome. Yeah. Thank you very much.
I had to learn about with shipping. I didn't realize how complex and what a ecosystem there is for shipping and getting a drop shipping.
Yep. So. Well, one thing is you said American made, so we don't have to worry about any tariffs on it. At least for now, we'll probably figure out a way to slap the tariffs on American made products.
Yeah,
so, Dr. Lowe. Website is tefball.com, TEFBALL.com. Want to encourage you to go to check it out. Use the discount code Dental Brief. Dr. Lowe, thanks so much for coming on today.
Thanks for having me. Appreciate that.
Thanks for listening to this episode of the Dental Brief. If you found it helpful, give it a thumbs up, subscribe to the channel, and share it with a colleague who could benefit. We're here to help dental professionals like you stay ahead of the curve, one brief episode at a time. You can find more episodes and resources at thedentalbrief.com. You can also join the Growth-Minded Dentist community on Facebook. Links are in the description. Until next time, keep learning, keep growing, and thanks for being part of the Dental Brief community.